This week, the Centers for Disease Control and Prevention reduced the number of vaccines required for children. Joining us now to explain what this means for you and your family, infectious disease expert, Dr. John Bradley. Dr. Bradley, good to see you again, my friend.
Thank you so much, Raul.
Happy New Year. The biggest changes announced this week, how do you kind of put that in perspective for folks who may not be familiar with what it really means?
So the usual process for vaccine recommendations for the shots that go into your child's arm is a consensus process in which the American Academy of Pediatrics, Family Practice, CDC, all of these players are at the same table. And I had the privilege of being at that table, 25 people all discussing. But it's a consensus recommendation. So no one group, neither the CDC nor the Academy of Pediatrics, should come out with a statement that's focused only with their background. It needs to be consensus. So what's unique about this recommendation is that the CDC is coming out with these new recommendations without consulting with any of the professional organizations.
My obvious question is, why? If there was a standard operating procedure to do something like this that is so impactful for so many people, why avoid the common process of getting the consensus from all the professionals with all the expertise?
I don't have the answer to that question, but the government clearly has made a recommendation, and we're dealing with it. And the American Academy of Pediatrics came out with a strong statement that they do not agree with the CDC's recommendations. And in my 40 years of infectious disease, I have never seen that sort of disconnect.
I was going to ask, have you ever seen a disconnect between the CDC and the American Pediatrics? I mean, I don't think I have in just the time that I've been working.
No, and on national committees that I've been on, we're all at the same table. We all discuss the problems. We all come up with recommendations together, and that's worked really, really well. This is an aberration, and I'm very happy that the Academy of Pediatrics is pushing back and saying, no, these new CDC recommendations are not in the best interests of child health.
For the layman out there, just your common mom, dad, your parents out there, it's confusing. It's a confusing time because you don't know who to believe and who to trust and who to listen to at this point. What does this mean for parents, for new parents?
So pediatricians have the education, experience, background. They take care of children. The CDC does not take care of children. So the pediatricians get all of this information from all of the sources, and we come up with recommendations that then the parents can be made aware of and are the basis for the shots that we give to protect children. So the government says we're giving too many shots. Well, in fact, many will argue we don't give enough shots. We have new vaccines coming out all of the time. And when a new vaccine is approved, licensed by the FDA, these committees get together and discuss at great length, hours, days, to figure out how that new vaccine fits into the immunization policy. It's not arbitrary.
Will there still be mandatory vaccines? Because from what I read, it went from the 18 mandatory, now it's only 11, and the rest of them for high risk. Explain all of that to me.
So mandatory is a word I don't generally use. It's highly recommended, yes. And unless you have a reason to not get it, we expect that you'll get it.
Yes.
And it's a public health request, because if your child is immunized for something like meningococcus, then your child will not get that infection and will not spread it to other kids. So by protecting your child, you're also protecting all of the children who associate with your child. And as a pediatrician, population health, the health of all children, is at the top of my list, and the health of every child is part of that construct.
To that I ask, how does this impact the admission process at schools? When I was growing up, there's a certain guideline. You have to have certain vaccinations.
Yes.
That's been in the news.
Yes, it has.
The last couple of years as well. How does that affect that?
There will be no change. The guidance for our schools comes through our county and state, and we take what the CDC says into advisement, but it's California state that actually makes the rules that we all follow, and we get to participate in that. And the state of California has said, including the governor, that we do not believe in these new CDC recommendations. We're going to follow what we've been doing, which is aligned with the American Academy of Pediatrics.
Who falls under this high-risk group for vaccines?
So children who don't respond normally to vaccines because their immune systems don't work or they have chronic illnesses.
The new recommendations for HPV, where are those?
So great question. When a vaccine is
It's a lot of kind of maneuvering through all the...
Yes. Whenever a new vaccine comes out, there will be studies that show 2 doses will work and give you long-lasting protection. And with HPV, you want protection to last 20, 30 years. And we don't know necessarily that 1 dose works, but those studies can be done. And if you get a nice response, it may be that all you need is 1 dose. So this group that I've been talking to you about, that is AAP, NCDC, and family practice docs, if there are new data on the HPV vaccine that 1 dose is protective, long-lasting protection, then the guidelines will change. Our guidelines change based on scientific evidence. They change all the time. What you get at any moment is the best information we have from the current science.
Final question, because we could talk about this for hours, but how concerning for doctors, how concerning for you is the, I'm going to call it kind of the disagreement that is happening within agencies in the government right now? How concerning is it that people might not get their kids vaccinated and what that could eventually lead to?
So you touch on 2 points. I think the doctors realize that this recommendation is very unique, coming only from CDC. It's not been vetted through our professional societies. So the doctors aren't buying into it. But parents are listening to what's on the news. They're listening to you, Raul.
I know.
And they want to know what to do. And my advice is follow your pediatrician's advice. The CDC has been a wonderful partner with us, but if they're going out on their own to make clinical recommendations for what the pediatricians do, that's unique, and I'm sure there will be discussion within all of these professional societies. But for the moment, the parents and the pediatricians should follow AAP policy.
God help us, don't listen to me. This is why we have Dr. John Bradley with all of your expertise. As always, sir, great to see you.